Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. We are going to explain the spinal anesthesia. So the first is some basic points, that is the normal extent of the spinal cord. Let's look at the normal extent. So normal extent of the spinal cord. Spinal cord, we are writing it as SC. So what is the normal extent? Normal extent is the lower border of L1. So it is nothing but the lower border. So it is the lower border of L1. And over border of L1, this is seen in terms of the adults. Next is the upper border. So it will be the upper border, and the upper border is in terms of the L3, and this is seen in terms of the children. So lower border L1 in adults and upper border L3 in terms of the infants. So not children, it is the infants. And the first spinal anesthesia was given by, so these are very important points. So the first SA means the spinal anesthesia. So the first spinal anesthesia is given by the Augustine Beer. So it is the Augustine Beer. So Augustine Beer means AUGUSTIN and BIER. So it is the Augustine Beer. So next is where it is injected. So it is injected in the space of L3. So the injection. So it is injected into the space. It is between the L3 to the L4 in terms of the adults. So it is L3 to L4 in terms of adults, and next is the L4 to L5. So L4 to L5 in terms of the children. Now the deposition of the drug. So where is it deposited? So this deposition of the drug is taking place in the subarachnoid space. So SAS. So it is nothing but the subarachnoid space. Now the subarachnoid space, it ends at S2 in adults. So the subarachnoid space, if you see, it ends at S2. It ends at S2 in terms of adults, and then it ends at S3, and S3 is in terms of the children. So subarachnoid space, it ends at S2 in adults and S3 in terms of children. Now let's look at the traumatic needle. So we need to know two needles. So first is the traumatic needle. So when you look at the traumatic needle, it is the Quincke's. Next is the atraumatic needle. So there are two needles. One is the traumatic needle, one is the atraumatic needle. So traumatic needle is the Quincke's needle, and a traumatic needle is a Sprotty's needle. So what are the structures which are pierced? So let's look at the structures which are pierced. So structures pierced, it includes the ligamentum flavum. So it includes the ligamentum flavum. Next is the interspinous ligament. So it includes the ligamentum flavum, interspinous ligament, and the supraspinous ligament. Next is the supraspinous ligament. So it includes the ligamentum flavum, is the structure pierced, then is the interspinous ligament, then is the supraspinous ligament. So there are three ligaments which is used. So there's a posterior ligament is not punctured. So important thing is posterior ligament. This is not punctured. So posterior ligament is not punctured. So what is the first fiber to be blocked? So what is the first fibers to be blocked? So the first fiber to be blocked is the autonomic preganglionic. So it is the autonomic preganglionic. Then is the last fibers. The last fibers to be blocked, it is nothing but the motor. So the first fibers to be blocked is autonomic preganglionic. The last fibers to be blocked is motor. The last fibers to recover. The last fibers to recover is the preganglionic autonomic. It is a preganglionic autonomic. So first fibers, it includes the autonomic preganglionic. Last fibers to be blocked is the motor, and the last fibers to recover. So to block, the last fibers to block is motor, the last fibers to recover is the preganglionic autonomic. Preganglionic autonomic. Next is the levels of anesthetic effect. So what are the levels? Of the anesthetic effect. So this involves the autonomic level is 2 segments above the sensory. So this is the autonomic level. It is 2 segments above the sensory. It is 2 segments above the sensory, and which is 2 segments above the motor. It is 2 segments which is above the motor. It is above the motor. Now the most common complication is hypotension. So MC complication. The most common complication here is the hypotension. And now let's look at the Brewer-Lukat's reflex. The Brewer-Lukat's reflex. So Brewer-Lukat's reflex is a reflex hypotension. It is nothing but the R hypotension, reflex hypotension. So this is due to the parasympathetic stress. So it is due to the parasympathetic stress, and it is at a different site. It is at totally different site. It will be at a different site. Next is the paramedian spinal anesthesia. There is paramedian SA. We are writing as paramedian SA. The paramedian spinal anesthesia, it prevents the penetration of the supraspinous and the intraspinous ligament. So paramedian spinal anesthesia, it prevents the penetration. It prevents the penetration. So it prevents the penetration of the supraspinous and the intraspinous. So supraspinous as well as the intraspinous ligament. Next is the anesthetics. So what are the anesthetics? So paramedian spinal anesthesia, it prevents the penetration of the supraspinous and intraspinous ligaments. Then the anesthetics in a paravertebral block. So anesthetics in terms of a paravertebral. Paravertebral block are least likely to diffuse into the subarachnoid space. They are least likely diffuse. They least likely diffuse into the subarachnoid space, SAS. Now what is the low incidence of the post-spinal headache? So low incidence of the post-spinal headache. So the least incidence of the post-spinal headache is when the thin needle is used. This is when very thin needle is used. Next is the high level of spinal injection is due to the high level of, or we can write it as high level. The high level of spinal injection. So the high level of spinal injection causes the hypotension and the bradycardia. It causes the hypotension. So there is hypotension as well as presence of the bradycardia. Next is the vasopressor of choice. So what is the vasopressor of choice? The vasopressor of choice is in hypotension. So vasopressor of choice in hypotension is produced during the subarachnoid block. During the subarachnoid block, we are writing it as SAB, subarachnoid block. It is nothing but the phenylephrine. It is nothing but the phenylephrine. To learn and grow daily like this, please do subscribe.